Good morning. It's December 10th, 2020. My name is Joe Doherty, the Director of Public Affairs for the Utah Department of Public Safety and the COVID-19 response for the state of Utah. Today, we will be pleased to hear from Dr. Angela Dunn, the state epidemiologist, Governor Gary Herbert, Governor-elect Spencer Cox, Rich Lakin, the immunization program manager for the Utah Department of Health, and Phil Dean, the interim director of the Governor's Office of Management and Budget. Dr. Dunn.
Thank you, Joe. Good morning. Today, our rolling 7-day average of new cases is 2,816. We added an additional 3,401 cases today. Last week, our rolling 7-day average was 2,627. Our rolling percent positivity now is 26.2%, a slight increase from 24.2% last week. Both are up slightly, but it is not nearly the surge we were expecting post-Thanksgiving. Today, we are reporting 21 new deaths. This is the third day in a row we've reported over 20 deaths in a single day. And this is definitely related to the November surge we saw in cases. And now we sadly have over 1,000 deaths in Utah related to COVID-19. While this number represents a very small fraction of individuals who actually get infected with COVID-19, we still must make every effort to do our part to protect the lives and livelihoods of Utahns. 1,016 deaths due to COVID in Utah is tragic. And we can prevent additional deaths in Utah by continuing to wear our masks, staying home when we're ill, and limiting our close contacts to our household members as much as possible. I'd like to now switch gears to talk about an exciting new contact tracing strategy. Beginning tomorrow, we are going to launch automated contact tracing. So some people who test positive for COVID-19 will receive a text instead of a phone call from public health contact tracers, and this will be noted in the text. The text will include a link to a secure form where the person who tested positive can provide information related to the case investigation and contact tracing electronically. There will also be a phone number in the link if the person would like to speak to a case investigator instead of doing the online form. Just want to note that we're never going to ask for personal information via text. It will only be in the secure form. If you receive a text and you have additional questions, you can call that phone number in the text or call our coronavirus hotline for more information. Thank you.
Thank you, Dr. Dunn. And again, welcome to everybody. We are again honored to be with you at our weekly press conference and availability. As Dr. Dunn mentioned, we just have completed, it's been 2 weeks since Thanksgiving. And although we were bracing for a big surge, the good news is it didn't happen. As you know, in preparation for that, we had kind of a 2-week pause we put in place for people to think in terms of what can we do to make our gatherings smaller and shorter. We recommended to people that it was probably best if they had just dinner with those in their own home. And we appreciate the fact that many people followed that counsel. And I think that's led to us, instead of being in the 3,000 to 4,000 range, which we'd anticipated, maybe up to 5,000 cases, we've been in the mid 2,000s. We're about 2,800 now on our rolling average, but much smaller. Still too many, but much smaller than what we'd anticipated could happen. And so that social pause we put in place to stay home, stay safe, it worked. I also want to give a shout out to our young people. We allowed the playoffs to continue with our football teams. And they were close to the end of their season, but they took that challenge seriously. Not only did we have testing, but they were very disciplined in wearing masks and social distancing. And so we had very few infections with those competing in football. And we appreciate, again, the work. And as Dr. Dunn has said, we all need to act like we're on the football team and really commit ourselves and dedicate ourselves to being having that kind of discipline of social distancing, wearing the masks, appropriate hygiene protocols, so that we can stay safe. We want to thank those who, in fact, took this seriously during the holiday season. But to use the football analogy, we're not ready to spike the football now. This is still in the middle of the holiday season. We traditionally have a lot of family gatherings and get together friends and celebrate the holiday season through December and into the new year. But it's not time for us to give up our commitment to social distancing, wearing a mask, and minimize the risk by having smaller and shorter gatherings that we meet with people. And again, minimizing the risk by appropriately just dining and meeting with people of our own household until we get through this holiday season. Now, I appreciate the fact that there's a lot of messages out there that are helping us. Our faith-based leaders have been stepping up and telling those in their congregations to follow the counsel of being a good neighbor, caring about those around you, love your neighbor as yourself, and showing respect by wearing a mask and social distancing. And I appreciate the fact that we're getting good counsel from our religious leaders in the state, and we'd encourage all of us to follow that good counsel from our religious leaders. Let me also just mention one thing that we tend to forget, I think, a little bit. We concentrate so much on the mortality rate, and today it was a number of over 1,000 of our fellow Utahns who passed away because of COVID-19. But we also not only mourn their loss, but we also recognize that there are many people out there that don't pass away but still have severe reaction. The long haulers, which we've had featured on some of our media events on television and in the newsprint, is something we ought to remember. We don't know a lot about this coronavirus. We're learning as we go. There's still a lot that we don't know. But we do know that there's effects that impact people that are long-term, whether it's loss of sense of smell, taste, some neurological problems, heart, lungs, fatigue, affecting our nervous system. There's just a lot of things that are taking place there that have nothing to do with dying. They just have to do with poor health. So again, we want to remind ourselves that we need to be careful about that, not just about death, but the long-term effects of this COVID-19. I had the opportunity yesterday, as we know, we see a little daylight at the end of the tunnel, and with the vaccines coming. And I had a chance to talk to General Gus Perna yesterday, and he reiterated his commitment to making sure that we are going to receive the vaccines that were proportionally allowed as a state. And so the first shipment of the Pfizer vaccine will be shipped within 24 hours of FDA approval. We hope that happens here in this next week. And we'll receive through December, 154,600 doses of their vaccine. He's also promised that in January we'll receive another 154,600 for the second doses, plus some additional. So I'm confident in having talked with them that the government will deliver on this supply that we've requested. We're going to clearly try to get as many doses of the vaccine as we can, not only the Pfizer, but the Moderna and others that are in the pipeline too over the next month to 8 weeks that will be approved too, I believe, in talking to, again, General Perna from the Health and Human Services. He's over, in fact, the vaccine distribution side. We're going to look to have Rich Lakin talk about that here in a bit, about how we're going to be distributing the vaccine here and give some of the details. So he'll give a little bit more of that in a few minutes. Let me also add here one last thing, and that is, as part of our deployment of the vaccine, who gets it? We'd like to have everybody to get it that wants to have it. That's going to take some time to build up the supplies so that we have all that's necessary to vaccinate the people of Utah. But as we get this in waves, as it comes and grows, we have to have a priority list, which is being prepared by our Strategic Vaccination Coalition. And at the top of that list is our healthcare providers, those who are in the hospitals, on the front lines, those working in long-term care centers and our clinics, those who really are on the front lines of helping us treat those who have COVID-19. We want to make sure that they don't get sick at the same time. The coalition has recommended that we, in fact, include in that group our teachers and our educators. That means principals, superintendents, staff members, and our teachers, again, on the front lines of education. And so I'm pleased to announce today that educators and staff in our K through 12 schools will be eligible to receive the vaccine in what we call phase one in our second wave of this distribution. So they're going to be at the front of the line, and we expect that they will, in fact, have our teachers be able to receive vaccinations by the end of December or the first part of January. So again, I think that's going to help in many levels. One, we want to make sure that our students are going to school to learn. We need students to learn, but we need teachers to be able to teach. And we're trying to make sure we have as safe an environment for our students and our teachers as we can, so they can continue to teach in class. This will help minimize disruption for families at home, and we hope to minimize the ping pong effect that's happening with going to online or in class, or a combination of both back and forth. So we think this is going to be a step in the right direction, certainly to help our teachers and those involved with education K through 12. By the way, you can learn more about our distribution plans and all that you want to know about the COVID-19, the coronavirus, by going to coronavirus.utah.gov. That's, again, a very detailed web page, answers most all of the questions you would have and give you more insight on what we're doing and the latest information on how we're going to be distributing the vaccine. So again, with that, we have a new administration coming in. I've got about 25 days left to go until we turn the gavel over to Spencer Cox as our new governor and his administration. We want to assure you that there's going to be a smooth handoff, particularly when it comes to fighting this pandemic. And so I've asked Lieutenant Governor Spencer Cox, soon to be Governor Spencer Cox, to come and speak about this transition. So Spencer.
Thank you, Governor. Ladies and gentlemen, it's great to be with you again today. I want to specifically thank Governor Herbert for his leadership over these the past 11 plus years, and especially over the past 9 months as we have gone through this terrible pandemic together. We're grateful for the wisdom and leadership, the steady hand that he has shown in working with our healthcare officials, with our legislators, our economic officials, and so many others, having been placed in a very, very difficult position, one that no governor in the state has been placed in for over 100 years. And I certainly want to thank him for his service and for helping us get to where we are. This really is an incredible day as we are talking about vaccines and knowing that that very likely in less than a week those vaccines will be here and that people will be getting those shots and people will be as we know, these vaccines are very effective, and that they will be achieving immunity without getting the disease. This really is the miracle we've all been praying for and hoping for, and to be able to have these vaccines delivered in record time is a testament to technological advancement. It's a testament to the tenacity of researchers and scientists who have been working around the clock to make this happen. It's a testament to Operation Warp Speed, to a federal government who got one thing very right in the way that they have worked to put this plan together and to develop these vaccines, get them produced and manufactured and delivered to us as they will be coming in the coming days. And so there should be great anticipation. There should be excitement. And more than anything, there should be hope. Hope in knowing that there is an end to this pandemic and it is coming. And with that hope, a renewed determination to do what we all know we need to do as we get through this holiday season to protect lives. We don't need to have the deaths that we're having now. And every one of us can do something to prevent those deaths, knowing that those shots, those vaccines will literally save lives and allow people to continue and build Utah as we rebuild coming out of this crisis. So we just wanted to take a moment to let you know that as an incoming administration, as we will be receiving these vaccines, our number one priority, our number two priority, our number three priority is to get these vaccines distributed to Utahns quickly and efficiently. This means that we don't want vaccines sitting on shelves in hospitals or pharmacies. It means that we will be working very closely with our distribution partners around the clock to get these vaccines out and to get them, again, in people's arms as quickly as we possibly can. We're grateful to the Utah Department of Health, and you're going to be hearing from Rich Lakin in just a moment for his incredible leadership. This is the last month has just been just amazing to watch the way that they are operating to try to figure out this puzzle of who gets the vaccine when and how we get the vaccine distributed. We will continue to work with our federal partners. As the governor mentioned, these are federal partners, the vaccine manufacturers. They will be manufacturing the vaccine as quickly as they possibly can. These two vaccines that have been approved are 2-dose vaccines, and so it is important that people get those second doses. And so we will, as we receive that, we will make those second doses available. There's a lot of discussion happening out there around the effectiveness of just one dose, but we do know that through the trial period, everyone did get 2 doses. And so while there certainly is, they are effective to a limited extent, as we know, with 1 dose, we want to make sure that we get those second doses. And again, we get them out as quickly as possible. As the governor mentioned, the first phase of our vaccine deployment will center around our hospitals and our pharmacies, and then our pharmacies will go to our long-term care facilities, our teachers, our emergency responders, and all of the industries whose employees are inherently at high risk. And so these are very difficult decisions determining who gets what. We're very excited for the opportunity to elevate teachers, because we do know that the impacts of this pandemic aren't just on the health side. They are related, especially on the education side, and teachers who have done just remarkable work over the past year in adapting their plans, in doing everything they can to get kids back into school, to make sure that they are doing so safely and that we're protecting the lives of those teachers, especially those who are vulnerable, in being able to make sure that our kids are not falling behind and that we're continuing the progress that is so important for them. So this is an exciting time. It is a rare opportunity for us to celebrate during what has been a very difficult year. But again, I just want to thank our team at Public Health. They don't get the recognition they deserve. They have been toiling every day, every night to do everything possible to make sure that the extent of the pandemic, the impact of the pandemic is lessened. And so I want to thank Rich and Dr. Dunn and their team for all that they have done. And I'm honored to turn the podium over now to Rich Lakin, who will talk more about vaccine distribution. Rich?
Thank you, Governor, Lieutenant Governor. What an exciting time, really. There's some light at the end of the tunnel. So I want to provide some clarity on what is expected with the vaccine and the approval process over the next several days. So as you know, the Vaccines and Related Biological Products Advisory Committee, known as VRPAC, has started its review of the Pfizer vaccine. This is an independent advisory board that will make recommendation to the FDA on whether to approve the vaccine or not. FDA will consider the recommendation and make a final decision likely in the next day or two. The FDA is not bound by VRPAC's recommendation, but it usually follows their recommendation. So what does that mean? So within 24 hours of the decision, we expect the vaccine will begin shipping to Utah. We expect 23,400 doses to arrive in the state during this first allocation. Again, this is the week of December 13th. All of those doses will be shipped directly to hospitals in the state that will then be responsible for administering the vaccine to their employees. Each of these hospitals has been training and preparing to receive the vaccine for a long time. I'm confident our state and all of our vaccine partners are ready to implement our plan. And, we've been doing this for months. We're ready. We're ready to get started. Over the final weeks of December, we anticipated an additional 131,000 doses to be shipped in the state in a similar fashion. So between those two doses of 23,400 and the additional doses that we'll be receiving also the week of December 13th, is that total that the governor had mentioned. And by the end of the month, it's possible we start immunizing people outside the initial focus of hospital healthcare workers. This includes long-term care facility staff and residents, non-hospital healthcare workers, and as the governor had mentioned, school staff. So how quickly we are able to get to those groups depends entirely upon how quickly the federal government is able to ship us vaccine and how fast our partners can get those vaccines into the arms of those that would like to receive it. I want to mention that we're in the process of incorporating a new data element into our data dashboard. We will soon begin posting data on the immunization efforts in the same manner we share information about access. I also want to make sure that you are aware of the coronavirus utah.gov vaccine webpage. This is the best source for reviewing the most updated vaccine plan, as well as for general information about the vaccine and its safety and efficacy. Again, I'll end there. Thank you.
As Phil Dean is coming up to the podium, let me just introduce so that everybody knows who Phil Dean is. Phil's been a stalwart in our Office of Management and Budget for many years. He's currently the acting director for the Office of Management and Budget. And the Office of Management and Budget, the emphasis is on budget. They're the accounting firm, really arm that tracks the money. Why we spend it, where we spend it is on their watch, and they know where the dollars and the pennies, in fact, go. So I'd ask Phil to come and speak a little bit today on the CARES Act money. There's some confusion about what we received and where it's gone. And so we've asked him to take a couple of minutes here to explain at least that portion of our budget. So Phil?
Thank you, Governor. Again, my name is Phil Dean. I currently serve as Director of the Governor's Office of Management and Budget. As you may know, the state received $935 million in discretionary CARES Act funding. This entire $935 million has been fully allocated. Of this total, $290 million is for direct COVID response. $249 million was allocated to economic response to the pandemic. $248 million went to cities and counties, and $148 million went to education purposes. To date, we've paid out all but about $200 million of this, although again, that $200 million has been fully allocated. This unpaid balance includes allocations for which goods and services have already been provided in November and payments are in process. It also includes goods and services that will be provided to the state in December. Big ticket items that we are in the process of spending that money on include about $80 million for COVID testing, including test purchases and hospital expenses related to testing, about $64 million for schools, which includes broadband installations in schools throughout the state, about $20 million for fiber installation in rural Utah to facilitate broadband access, and about $10 million for residential housing assistance. Thank you.
Thank you, Phil. We appreciate the work of the Office of Management and Budget. There you have really a magnificent challenge with our budget of $20 billion and how it's spent and working with the legislature and with the executive branch. So we appreciate, Phil, your good work, and particularly this unique time with this pandemic. With that, let me just conclude and say a few things, and we'll see about any questions that might be out there. As I mentioned earlier, we've learned a lot in these past 9 months. But as we've learned a lot, we also know there's still a lot more yet to learn. What is the impact on the coronavirus on us long term? We know some of the short-term impacts. In fact, the data we received here might be of interest to the listening public. 77% of those who've died of COVID-19 are over the age of 65. Clearly, this has a more severe reaction to those who are elderly. 77% of those who've died of COVID-19 are over the age of 65. 62% of those are men. It impacts men a little more severe than women. Our mortality rate is now down to 0.4%, so it's a small number. But still, as you heard today, we're now over 1,000, about 1,018, I think, of deaths that have occurred here in the state of Utah. And we mourn each and every one of those losses that are premature for a person's lifespan. We also recognize, as I mentioned earlier, that it's not just about the mortality, but it is about, in fact, some of the other impacts that they have on people's health. We talked about the long haulers that have significant challenges to their health, loss of sense of smell and taste for months at a time, memory loss, nerve damage, hearts, lungs, bouts of depression, anxiety, fatigue, and fear for months after the infection. Those are just a sum of the impacts long term that we're noticing here these past 9 months. The long haulers, I appreciate the fact that the Salt Lake County Health Department is telling the stories of these long haulers for the past few months, and they're sharing with long haulers their stories through the Utah coronavirus social media channels that are out there. And so again, we appreciate their work in trying to help us all become better informed. And last but not least, again, we just mentioned something today about what we're going to be doing to help our educators get to the front of the line to get a vaccination. I want to make sure that I express my appreciation, particularly to the UEA, for helping us come together on this issue. It's important to teachers, it's important to us as the community of Utah, particularly for those of us who have children, grandchildren in school. I want to make sure they have a good education and provide an environment where they can go to and parents can feel comfortable and confident that they're going to a safe environment, and teachers likewise can know that they're going to a safe environment. The data shows that that, in fact, is occurring. We're going to strengthen that by making sure that our teachers have the opportunity to be the front of the line to get this vaccine and be inoculated so they can continue to go to school and teach and have minimal disruption with our in-person teaching that's going on throughout the state. So a major step here today, a change in policy modification, which we think is going to be a win-win for everybody, and we appreciate the work of the UEA in helping that to happen. So with that, again, we encourage all of us, let's stay strong. We certainly aren't out of the woods yet. There's still more to do. And we need to not relax, not give up, but stay the course. Again, the common themes that we have out there are social distancing, staying away from those who may have the coronavirus, wearing a mask when you can't social distance for sure, and even when we can, having belt and suspenders approach is probably a good thing to minimize the risk to all of us. And certainly proper hygiene as we work together. The vaccine gives us hope that we see the beginning of the end. And so there's a lot to be hopeful for as we go into 2021. Let's make sure we get through the holiday season safe and sound. With that, we'll see if there's any questions.
Hey, it's Michael Locklear with 2 News. I have a question about the automated contact tracing. What technology is making that possible? And will that replace all the calls, or how does this change the workflow for the existing contact tracers?
Sure. So the automatic contact tracing is part of our existing surveillance system infrastructure. It's giving our surveillance system in-house the ability to send text messages out. So it is all built in-house within the Utah Department of Health. So the way it's going to work initially is that individuals who don't respond to the first phone call, if we have a good phone number on file, we will then text them. It'll just be within our workflow before we figure out the efficiency and efficacy of it to roll it out more broadly.
And And then for their close contacts, does it then send a text message to those people as
Yeah.
well? And will this allow you to reach people that you don't have the capacity to do now?
Exactly. So the hope is that it's speeding up the initial case investigation process. And in that secure form on the link that's going to be in the text message is an opportunity for the person who tested positive to put in all the information for their close contacts, again, allowing public health contact tracers to reach out to the close contacts either by phone or by text.
Next question.
Hi, this is Erin from the Trib. A couple of weeks ago, we heard that Utah was projected to get like 400,000 vaccines in December, vaccine doses in December. Now it's down to 154,000. Can you tell me what happened? Why is the number so much lower now? And is there some problem with the federal procurement of the vaccines?
Probably more than one answer to that. Part of it is we don't know all that's happened back in Washington with the Department of Health and our CDC. But as they find what is actually being produced, the supply that's available, they've done a proportionate run through that and say Utah is entitled to 154,600 on this first allocation. It'll actually come in waves. It won't come all at one time at 154,006. We've just been guaranteed 154,600 doses by the end of December. I think part of it too is they've also assured us that there'll be the second dose, another 154,600 in January, a month later. And I expect that in order to hedge the bet, make sure that everybody gets the second shot, that they're going to hold some of those vaccines back to make sure that they've got them on supply, which means that they probably can't produce enough for us to have the 400 or 370,000, I think is the actual number we'd heard this first wave. But again, in talking to Dr. Perna, or General Perna rather, I know that they're doing everything they can in this public-private partnership to get as much supply of the vaccines as soon as we can to give to as many people that want it. We're united in that effort. And as has been mentioned, this is called Operation Warp Speed. We've done in 8 or 9 months what normally takes 3 to 5 years to be done. And so again, props to the private sector for stepping up and doing what they've done. It has been in partnership with the federal government, but it's remarkable that we have a vaccine that's being approved now. People are going to receive vaccinations this month in such a short period of time. We just now need to ramp up the supply, get as much as we can, as soon as we can, to vaccinate as many people as want to have it. Next question.
Good morning, Governor. This is Jed Bowl from KSL TV. I've heard varying ranges on the percentage of people it will take to achieve herd immunity. I've heard between 60 and 80%. What percentage of Utahns need to get vaccinated to help us achieve herd immunity and stop the virus? And what impact does the 95% efficacy of the Pfizer vaccine have on that ability to achieve herd immunity?
Good questions. It sounds like between 60 and 80, it must be 70. But I'm going to let the epidemiologist speak to that very thing.
So we need between 60 and 80% of Utahns to get vaccinated in order to achieve herd immunity. You're right, Governor. It does land around 70%. That 95% efficacy is built into those estimates. Those estimates are based on other infectious diseases that behave in a similar way. So we're able to determine that. And again, no vaccine out there is 100%. So those kind of ranges are always built into the estimates. So we're really relying on a large percentage of the Utah population to get vaccinated as quickly as possible so that we can resume life as normal as possible.
I'll just add, Jed, that again, I was on a phone call with all the governors here just a couple of days ago, and one of the things that everybody was very appreciative of is, one, how fast this has come about, but the effectiveness, being at the 95% effective rate, was much higher than what we originally thought was going to happen. It might have been 50 or 60% effective. That means you have to have that much more of supply. So the fact that we have such a high rate of effectiveness with this vaccine gives us some assurance that we can get herd immunity with lesser people participating. So it's all good. We love the trend that's going on. We just want to get it produced and out to the public as soon as we can. Next question.
Governor, this is Wendy Leonard with Deseret News. Utah's reached 1,000 deaths, and it took us several months to get to the first 500 and just 2 more to double that. What are your thoughts on that, and how will Utahn's behavior affect how quickly we get to the next grim milestone in deaths?
Well, you know, we mourn the deaths of anybody who passes away prematurely. And again, we have people, we lose lives in many different and varied ways, but now we see that the COVID-19 is up there with heart disease as far as a factor for people's lives being shortened. So we take that very seriously. We also understand and mourn the fact that a lot of this could be prevented. Just like wearing seat belts can help prevent the loss of life on our freeways. Proper protocols of social distancing, wearing of the mask, we find will help us, in fact, minimize the loss of life and loss of health that comes from this pandemic. So again, that's the preventable side. And we have people, again, that we see all the time in the media, people pleading with us. They've lost a loved one. Please wear the mask. We had the University of Utah study, which I would hearken to, that it was really kind of mirrored the other many 120, 130 other studies out there that are available that show that by mask on mask, wearing of mask, you wear the mask, I wear the mask, we reduce our risk of sharing the virus by over 70 to 80%. Those are things we can do. We can control our own destiny, and we can control the destiny of those around us. So as our faith-based leaders have said, we ought to remember the great commandment to love God first, but second, to love our neighbor. And it's hard to love your neighbor if we're putting them at risk, and particularly if we're doing it intentionally. So again, all of us can do better. I've said before, all of us have a role to play. All of us can do something better. And if all of us do a little something better, we'll get a lot better. We saw the slowdown when we took a little bit of a 2-week pause. We're more cognizant about our social gatherings, limiting our size and the duration of our gatherings. And it made a difference. It's made a difference. We see the outcome now. So we mourn the deaths of anybody. And to the extent we can control the outcomes, let's do it. Let's redouble our efforts. The vaccine's going to help us, but we still have got 6 months before we'll get to that herd immunity stage where everybody has the opportunity to have vaccinations if they choose. I think the majority of Utahns, polling shows probably 70, 75% will want to have the vaccine. And that's going to be a great day. I expect that'll happen sometime this summer. So, but in the meantime, we need to continue to stay the course of social distancing, proper hygiene, wash your hands, and wear the mask. Next question.
Hi, this is Sophia Evolito with the Associated Press. I have a question for the governor and governor-elect in regards to Attorney General Sean Reyes' decision to join the Texas lawsuit aimed at overturning the president's election loss. I know you both said in a statement last night that neither of you were consulted, but I wonder if either of you have spoken with the Attorney General about his decision to join this lawsuit. And can you further elaborate on why you believe we shouldn't intervene in other states' elections and taking an issue like this to the Supreme Court?
Well, I'll go first. I'll let the Lieutenant Governor mention too. We've had a good relationship with the Attorney General's office. I don't want to build a mountain out of a molehill here. We've been gathering on a monthly basis to be briefed by the Attorney General's office about litigation that we have going on constantly throughout the state. We've asked for that and have been granted that so that we are not blindsided by something that he's involved with that we don't know about. He's part of one of the constitutional officers, but we are the executive office of the governor, and so we need to have that kind of information. So it was a little disappointing yesterday when the first time I find out about this is when the press calls to ask for a comment. We've wondered about standing. I don't know that I understand how Texas has standing in this case with Pennsylvania's elections. I don't know how we have standing being a friend of the court, an amicus brief. And I do believe that, the ability to challenge if we have irregularities should be there on the table. But that's the responsibility of the candidate and the campaign. And as I mentioned in my comment yesterday, along with the Lieutenant Governor, I would take a dim view when I was Lieutenant Governor and running the elections office, having somebody come in and say, we're not doing it right in our state, when I know we're doing a very good job. We, in fact, ought to be a model for some others. Certainly, we know how to do mail-in ballots here and do it in a safe and sound and transparent way that's accurate. So I expect that if I would be offended if people came in and told us how to run our elections, that other states would be offended if we went to their state and told them how to run their elections. If there are irregularities, and there's probably irregularities in most every election somewhere, minimal though they may be, if the candidate feels like something needs to be addressed, that's why we do have courts. And they have the ability to access the courts and have the courts make a decision on what's correct or false under the law. That's happening. I know there's like 30 or 40, I think, lawsuits going on now that the candidates avail themselves of the opportunity. I just think this may be, in fact, is a waste of our taxpayers' dollars to engage in this. It's going to happen anyway without our involvement. Spencer?
Well, I think the governor said it best. Look, losing elections is really hard and it sucks. And we all would like to hope or think that there's a reason that we lost that is maybe different than the actual reason. And I know there are a lot of people out there who wish the election had turned out differently. And as the governor said, election irregularities are a thing. Voter fraud is a thing. And we should always be looking for voter fraud. We should root it out wherever it exists. We've been very fortunate here in the state of Utah to have very limited evidence of voter fraud ever. And I don't know that the Attorney General's office has prosecuted any voter fraud over the last several years that I've been involved as the chief elections officer in the state. I know that Texas has had some instances of voter fraud. I think they've prosecuted about 50 incidents of voter fraud over the past 10 years. But when you look at the total number of votes in a place like Texas, that's very small. And so there is a possibility that voter fraud has happened, but you actually have to have evidence. And I know there's a lot of evidence on YouTube and on the interwebs, and I've looked at it. It's all been easily debunked, and I keep waiting for the smoking gun that has been promised. I've yet to see it. I am an attorney, and I just have to be honest. I've looked at this case and looked at several of the others. I feel bad that people are being preyed upon, that they're, look, confirmation bias is a hell of a drug. It just is. And we all want to be proven right. We do, it's natural, I get it. But it can also be dangerous. And that's my biggest concern is, look, if there is voter fraud, yes, let's get that evidence out there. But in the 40 or 50 cases that have been there in front of judges, Republican appointed judges, there's yet to be any evidence that shows that there is something out there that could turn that election around. And so there are lots of other avenues to do this, lots of avenues that are doing it. Whether Utah gets involved in this won't change anything at all. It just costs money and taxpayer money. And so there are a lot of things that don't make sense. I've talked to a lot of attorneys, lots of attorneys that practice in this area, and I've asked any of them if they think there's any chance of this succeeding. And all the good ones tell me no. The mediocre ones tell me no, and I haven't found a bad one that said even yes yet. So again, it's a frustrating time for people, but we can do better. And sometimes we just lose. And sometimes we should try to win the next time and try to convince more voters. And I probably said too much already. The governor's getting very nervous over here. But I will say this, look, the Attorney General is independently elected. I love Sean. He's a dear friend. He's a great guy. Again, I don't want to make this, as he said, bigger than it has to be. He gets to make those decisions. In Utah, that's the way it works. He doesn't work for me. He doesn't work for the governor. He's independently elected, and he gets to make those decisions. And I know there are a lot of people in Utah that support what he's doing and inserting himself. But I don't think it's disputable. Utah's involvement will not change the outcome of that brief. It will not change the outcome of that lawsuit in any way. That would all happen whether or not Utah got involved. So I'll stop talking now.
Okay, the last question.
Good afternoon, Rick Aaron, ABC4 News. Back to COVID-19, with 67 deaths reported in the last 3 days, in addition to our normal non-COVID deaths, I was curious how the state medical examiner's office is handling the increase, and how does the refrigerated truck that's been parked outside of the office in Taylorsville factor into their contingency plans?
Dr. Dunn?
So you're right. Hold on. Okay. So you're right. Our medical examiner's office is starting to feel the strain of the COVID deaths on top of the deaths they always investigate. And as you mentioned, they have procured additional storage for decedents as they come in and have to await autopsy by our medical examiner's office, because they are nearing capacity within their own usual storage. And so that is happening. Right now, they are working, 7 days a week, trying to get autopsies done as quickly as possible for both closure of the families, but also surveillance and public health purposes as well. So they are working around the clock, and we don't expect that to slow down. I mean, these deaths, like I said before, are a direct result from our surge in November. What we can do as a public is make sure that we don't have another surge after Christmas. So continue the practices of wearing a mask, staying home when you're sick, and really trying to keep our close contacts with our household members only as much as possible will really help out not only a medical examiner's office, but our hospitals as well.
Well, let me thank all those who participated today on our program. We appreciate the press for covering this, for those who are at home listening to this. I'll just conclude by saying what I said last week. Again, this is kind of a Thanksgiving time of year. We just had Thanksgiving as the holiday. We have Hanukkah, we have Diwali, we have Christmas, family get-togethers in time to actually share our thoughts with each other. I hope it's not lost on us that we live in a wonderful time. In spite of the pandemic, we are living in probably the best time in the history of the world. The technology, the advancements in science, the quality of life that we enjoy is unparalleled in history. And so I hope we dwell more on the positive side, the things we're grateful for, as opposed to this momentary challenge we face with the pandemic. Not to minimize it, but there's a lot of other good things going on out there. Our economy is doing actually fairly well. We have sectors of our economy which are hurting, taking the brunt. Our hospitality industry, which we're going to be meeting with here shortly to see if we can find ways to help them improve their economic outcome. But we live in a really great time, and so I hope as we celebrate the holidays and meet with family and friends, hopefully in smaller groups for shorter time frames within the household, within your own walls of your household, that we remember to give thanks for the great blessings we have of living in this wonderful time. People are coming to Utah because this is a great place to live. It's a great place to raise families, and it's a great place to do business. We are really the leader in this country. And so that's a tribute to the people of Utah. So I'm thankful for all of you for what you do to make Utah such a great place to live. Thank you. Stay the course.
Thank you, Governor Herbert. As we excuse all of our speakers, I just wanted to add one more note to the question that Rick asked. We just checked. The medical examiner procured that trailer. It's been there since April, and they have yet to use it for any decedents. Right now, it was there as a precaution. We're a prepared state. We believe in preparedness, and we expect our state agencies to be prepared for eventual needs as well. So that'll conclude the briefing. We appreciate our interpreters in American Sign Language and in Spanish. Thank you, and we'll talk to you next week.